All right, so first we're going to be starting with the temple injections. Again, we were talking about creating a nice smooth contour between the forehead and cheek here. So I've chosen RHA4 here. It's going to have the most G prime or lifting capacity of the RHA collection here. So actually we're going to start on her right side. We'll do one side, that way we can show some comparisons here. So what we're going to do, I'm going to steal a little bit from Arthur Swift and his technique, his one up and one over, meaning one up and one over from the brow and then laterally to the temporal line here. We're just going to go straight down. Go ahead, Sheena, with your vibration just to help distract you a little bit. You can place that on maybe your chin, or that's great. All right, so again, we're using the RHA4 here, a little poke here, perfect. And what we're going to do to make sure we're in a safe plane is we're going to go right down to the periosteum here. So I'm going to withdraw slowly, and then I'm just going to gently massage that area just to see how that improves that contour. So again, besides helping the transition here, it can help with a little bit of lift to the area too. So that's a small amount. The temple, depending on how deep this concavity is, can actually require a lot of product. It's already helping a lot. I'm going to do a tiny bit more here. Again, we're going to do one up and one over. Go ahead, Sheena. Great, that's all I wanted to do with that. Now I'm going to do a little bit of volume. I'm going to save this for the opposite side there. We're going to use the same RHA4 line, and we're going to start targeting the cheeks here. We're going to do a tiny little bit starting from this point of maximal reflection here and work our way laterally. All right, go ahead, Sheena, with the vibration. Great, so I'm just going to make sure this area is cleaned again. I'm going to just gently withdraw here, and I'm going to make sure that we're injecting right down on the bone with a little pinch. Nice slow injection. I'm feeling the periosteum there. I know my needle's in a safe spot. I'm slowly injecting the amount here. Now I'm not going to do any more than about 0.1 in each little bolus here. I think that's not only a safe technique, but also affords a nice natural contour too. So I'm going to slowly withdraw. There might be a little oozing there. She's behaving, so I'm going to slide about 1 centimeter over, right down on periosteum. Slow injection, another 0.1 cc aliquot there. Slow withdrawal. See a tiny little oozer there, that's perfectly fine. Another injection here, and I'm just working my way laterally. I'm creating little pillars or pylons here that are essentially going to give me support for the cheek. It's going to help soften that nasolabial fold. And it's just going to create a more youthful contour to the cheek for Sheena here. Okay. So for the chin, what I'm going to do, I'm going to use, again, the RHA4 because I want something with a little more lifting capacity, a little more G prime, if you will. I'm going to use that same technique on the periosteum. You can certainly use a cannula here. I just think the chin injection on the periosteal plane lasts a little longer. Okay, rest your head back, Sheena. Perfect. So I've already marked out a few landmarks here. We've got the midline marked out, and then I've marked out kind of this width here, which corresponds to the width of her nose here, or her intercanthal distance. And females, you really don't want the chin any wider than that. So we're going to keep those proportions for her. So what you're going to go ahead, Sheena, with your vibration, you can go ahead and apply that maybe to your collarbone or something. Great. So you're going to feel a tiny little bit of injection, or a little poke right in the middle there. Good. And so I'm right down on Sheena's mandible there. Small aliquots. Now for the chin, which needs a little bit more oomph, if you will, or lifting capacity, I'm going to put 0.2 in this first injection. We're going to see how that looks. So that injection kind of did two things. It brought out the chin in this dimension, the horizontal dimension, but it also lengthened the chin as well. So I'm just going to gently mold that. Now some people may like that as well, but I think that's a little too projected for her, or too pointy, if you will. So I'm going to even it out by just doing a tiny little bit on each side. Okay, now we're going to target these nasolabial folds. We just did a little technique with our needle to try to build up the canine fossa area here. She was a little sensitive, so what we're going to do is just transition to our cannula technique. So what we'll do for this is I'm going to give a nice little pinch here, and we're going to go ahead, Sheena, with your vibration. We're going to use our entry needle here to make our pilot hole. So you're just going to feel a tiny poke right in the sub-Q there. So what we're going to do, we're going to just gently wiggle this around, make a little space for that needle. And we're going to withdraw. You might see a little flash of blood there. But now we're going to take our cannula. I'm going to go right in that same area. I'm stretching with my pinky there. And we enter it into that subcutaneous plane that my needle was in. So I tell patients that this feels a little funny. You're going to feel obviously the cannula underneath the skin, but it's certainly tolerated. Are you doing okay, Sheena? Mm-hmm. All right, so they're going to feel a tiny little bit of pressure underneath the skin here. And what I'm doing is kind of twofold. Not only am I breaking up a little bit of adhesions that form this nasolabial fold, but I'm laying down tiny little aliquots of product, again using RHA3, which gives me some good mobility or dynamic lifting power here, because this is an area that is certainly mobile.